Namaste, good morning and welcome to TimesHealth Plus. Today I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. Today we are going to discuss about one of the very important conditions and how we can deal with that before it sets into our body, and that is nothing but osteoporosis. I'm sure all of you must have heard about the term osteoporosis. Okay, so what happens exactly in osteoporosis is the quality of our bone goes down. The bones become weaker, and what happens is because of this weakness of bones, they become very susceptible to fractures. Okay, is it avoidable? So yes, we can work on not allowing the osteoporosis to set in our body. So it's very important to take care of your bone health well in advance before such condition can set in. Plus, if you know, osteoporosis is a very silent condition. You might not even know that it's setting into your body until and unless someone gets a fracture with a trivial trauma. A normal sneeze can also lead to fractures. Can you imagine the level that osteoporosis can go into? Okay, so that's what we need to understand. It's a very silent condition, and that's why taking care of our bone health becomes utmost important. Okay, so that bone health can be taken care of right from the beginning. So right from the childhood, you need to start taking care, you need to start educating your kids to take care of their bone health. It's very important. Now let's break some myths related to osteoporosis. I wanted to specifically target these myths because it's very important to understand that certain things cannot be taken for granted. Okay, so for the first myth that I would like to talk about is osteoporosis is only common in elderly. Okay, this is absolute myth. It's not just common in elderly, it can happen in younger ages too. There are many factors which can actually propagate osteoporosis, such as certain medications which are taken on a long-term basis, for example steroids. Okay, so that can lead to osteoporosis. If your nutritional habits are not that good, it can lead to osteoporosis. If there is no weight bearing or not much of exercise in your lifestyle, the lifestyle is pretty sedentary, that can also lead to osteoporosis. So there are many factors which can lead to osteoporosis, and which is why you cannot say that osteoporosis is only affecting the elderly. It can affect the younger ages too. So that's one of the myths that needs to be cleared off. The next thing is osteoporosis cannot affect men. That's not true. Okay, men can also be affected by osteoporosis. Okay, especially if there are some hormonal disturbances in the body, osteoporosis can happen in men too. So this is absolute myth that men cannot be affected by osteoporosis. If you have a sedentary lifestyle, your bone quality is going to go down. That's why it's very important to have an active lifestyle. Besides this, some habits like smoking, alcoholism can also lead to osteoporosis. So that also needs to be kept in check. Okay, so that can actually degrade the quality of bone, and which is why it's very important to sort these habits out. Okay, and not allow it to affect your body. So that's the next myth that is about osteoporosis. The third thing is, bones can tell you everything about osteoporosis? That's not true. There are many factors that are involved in osteoporosis. So you need to undergo a lot of tests to be able to exactly tell what level of osteoporosis is there in your body. So it's very important that you just don't rely on a bone scan, okay? And that is not the only factor that can tell you that you are osteoporotic, okay? So these are some of the myths that are related to osteoporosis. Some of the things that I would like to add on to this is why women are more affected due to osteoporosis. That is because at menopause that a woman goes through, there is a steep decline in the estrogen levels in the body. Okay, this estrogen is a bone protective hormone in nature, and because of this steep decline of estrogen, the bones can be easily affected. So which is why it's very important that we start working out on premenopausal stage itself on our bone quality. Okay, so it's very important to work on the bone quality before the menopause sets in itself. Okay, next thing is the important one more of the myths is that only vitamin D and calcium, taking that will be enough to prevent osteoporosis. That's not true. Along with vitamin D, calcium, you need to undergo a lot of lifestyle changes. You need to incorporate a lot of exercising in your routine in order to keep your bones healthy. So it's very important that you, besides supplementation and nutrition, you also take care of your lifestyle habits. Okay, so that's the next thing that is very important. Another important thing is that our body always responds to the demands. Okay, I wanted to explain this concept because it's very important to understand that the demand that you will place on your body, the body will respond to it. So for example, because if you are having a very sedentary lifestyle and you're not placing enough weight on your limbs, okay, then the bone quality is definitely going to go down because the body is not getting the demand to place the weight on the limbs. Okay, so it's very important that you have an active lifestyle, which is why if you might have heard people who go into space, the space does not have the effect of gravity, and so the bone quality degrades. Okay, there is a lot of weakening of the bones in people who go to space. Okay, why does that happen? Because the weight bearing is not happening. By explaining this to you, I'm sure I am telling you that whenever we want to improve our bone health or prevent osteoporosis, it's important to do weight bearing exercises. So anything that is going to put weight on your limbs, okay, that is going to improve the bone health. Okay, this is very important to understand because the yoga sequence that we are going to go through eventually is going to include a lot of weight bearing asanas. Okay, so it's very important to understand that weight bearing is an important factor to prevent osteoporosis. Another important thing is the muscle work. Okay, so let me explain this to you that our bones are constantly in a state of replenishing its stores. So what happens is the older bone cells, they are replaced by newer bone cells, and there is mineralization of bone that is constantly happening in our body. Okay, so it's very important to have a good muscle work because the muscles, they exert a pull on the bone, and that actually stimulates this process of bone formation and bone density. You know, the bone density improves as the muscle pulls on the bone. So muscle work becomes very important, which is why they also say that whenever you are working to prevent osteoporosis, you need to make sure that you do some weighted exercise. So something like a dumbbell exercise or weight cuff exercise is a good idea to do, okay, so as to improve your bone quality and bone health. Okay, so two important things that I have mentioned right now for a good bone health is one, weight bearing exercise, that means you are putting weight on your limbs, that is one, and the next one is having a good muscle work. So a conscious muscle work, using your muscles consciously, okay, that's going to exert the mechanical force on your bones and it's going to improve your bone quality and bone strength. Okay, it's very important to understand these concepts as we tend to ignore such small things in our daily life, and that actually can lead to such a silent disease which can lead to trivial fractures. Okay, the fractures can be really easy to happen. A trivial fall or even a bump on the road can lead to the fractures. Okay, so first, in the first part of this session, we are going to go through some asanas which are going to help with improving the quality of bone and preventing the process of osteoporosis. Okay, and in the next part of the session, I am going to just tell you in brief what all things need to be avoided in case if you already have osteoporosis. Alright, so let's get started with the asanas and the exercises that are required to improve your bone health. Okay, so we will start first by conditioning ourselves as a regular practice. So you can come onto your mats. Yes, you can join your feet together, keep your hands by the side. Look at one point in front of you. We are going to go for Sthit Prarthanasana. I'm going to explain to you why this conditioning is so important even when you're dealing with something such as osteoporosis. Keep your chin parallel to the ground. Slowly. Join your hands in front of your chest. And if you're confident of your balance, you can slowly close your eyes. If you feel a lot of sway in your body, you can keep your eyes open and even increase the distance between your feet. Slowly bring all your attention to your body and your breath. It's very important to shoo away any other thoughts that are coming into your mind and focus completely on your body and your breath. Slowly, you can release your hands, open your eyes, and we are going to start with a warm-up. Now, why was this Sthit Prarthanasana important? Okay, because we need to focus our entire energy, our entire mind to the asana practice that we are going to do. Okay, as much as possible, we have to gain insights from our body as to what is happening in different parts of our body. If we know that properly, it becomes very safe and it becomes much better to deal with a condition such as osteoporosis. Because in osteoporosis, a little fall or a little jerk can also lead to fractures or bone injuries. Okay, so if you are well aware of your body, if you have a good sense of the joints and the muscles in your body, okay, then you are going to be able to save yourself from a lot of these complications. So it's important to regularly educate yourself with the different asanas, with the different positions of the joints. Okay, it's important to make sure that your body is constantly learning about itself on a regular basis. Alright, so let's start with the warm up now. We keep a 1 foot distance between our feet. Slowly take your neck up and down. 1, 2, 3, 4, 5, 6, 7. Now we're going to turn our head to either sides. 1, 2, 3, 4, 5, 6, 7. Now drop your ear to the shoulder. 1, 2, 3, 4, 5, 6, 7. Now we move on to the shoulders. So just keep your hands on your shoulders and turn them around. 1. Make big circles out of your shoulders. 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. Okay, next we are going to rotate our wrist. So 1, 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. We're going to spread our fingers. So just spread them apart. 1, bring them closer and spread. 2, 3, 4, 5, 6, 7. Okay, now we're going to stretch our hands up and bend a little sideways. So just stretch your hands up and slowly bend sideways. 1, come back to the center, and the other side. 2, 3, 4, 5, 6, 7, and relax. Okay, now we're going to rotate our spine. So just turn. 1, 2, 3, 4, 5, 6, 7, and relax. Okay, now we're going to go for the hip movements. Okay, so you can keep a little bit of distance between the hip and just turn it around in circles. 1, 2, 3, 4, 5, 6 and 7. Okay, we do it the other way around. 1, 2, 3, 4, 5, 6, 7. Fine. Now we are going to go for the ankle rotations. Okay, so you stand on one leg. In case if you have a fear of fall or something, it's better to take support from the wall or from the chair. Okay, so you can use either of the things and then slowly you can rotate your ankle. 1, 2, 3, 4, 5, 6, 7. Okay, we do it on the other side, on the other foot. 1, 2, 3, 4, 5, 6, 7. Okay, once you are done with the ankle, now we are going to start with the asanas. It's going to be more of weight bearing. So understand how we are going to do the asanas. The first one is the talasana one. Okay, so wherein you come up on the toes and raise your one hand up overhead. Okay, so take a 1 foot distance between your feet. This is a very good asana for weight bearing and to improve the strength of your muscles. Okay, now let's start. Inhaling, take your one hand up. 1, 2 and stretch yourself up. Stay there. 1, 2, 3, 4, 5, 6. Exhaling, rotate your arm and bring it down from the side. Now we'll do it on the other side. Inhale, 1, 2, 3, stretch, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. It's better to fix your gaze at one point in front of you so that you don't lose your balance, and try to elongate yourself up towards the ceiling as much as possible. Okay, let's do it once again. Inhale, 1, 2, 3. Stretch, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Try to coordinate your arm and foot movement together as much as possible. Okay, let's do it on the other side. Inhale, 1, 2, 3. Stretch, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Okay, so it becomes very important to do a smooth and coordinated movement. Okay, if you are suffering from osteoporosis, jerks are not invited at all. So it's important to go at a slow, smooth and rhythmic pace that is going to improve the quality of your bones plus reduce the risk of any bone injuries. Let's do it one last time with the count and breathing. Inhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. The other side. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was Talasana 1. Now we are going to go for Ekpadasana. Okay, Ekpadasana is nothing but standing on one leg. So you are actually creating all the weight bearing on one leg. Okay, so it's a very good asana to stimulate bone growth again. So what you have to do is slowly lift your leg up and place it on the inner thigh as high as possible. Maintain your balance and slowly join your hands in front. 1, 2, 3, 4, 5, 6. Slowly relax and release. It's good to take support of the wall in case if you feel that your balance might go. So you can stand against the wall and you can do the same asana. 1, 2, 3, 4, 5, 6. Okay, slowly relax and release. So taking support of the wall is a good idea. Okay, or you can use a chair for support. Let's repeat this again. One, 2, 3, 4, 5, 6. Relax and release. And the other side. 1, 2, 3, 4, 5, 6. Relax and release. Okay, so this is Ekpadasana. We are going to also do Vrikshasana, which is slightly different from Ekpadasana. What we need to do is we need to keep our foot on top of the thigh. Okay, like that, and join your hands slowly up towards the ceiling. Maintain your posture. 1, 2, 3, 4, 5, 6. Slowly relax and release. And we do it on the other side. One, 2, 3, 4, 5, 6. Relax and release. Okay, you can do it again with the wall support. So go towards the wall. Place your back against the wall. Raise your leg up. Place it on the thigh. Slowly raise your hands up towards the ceiling and maintain the position. 1, 2, 3, 4, 5, 6. Okay, relax and release. And we do it on the other side, same against the wall. Place your foot on the thigh and raise your hands up. Stay there. 1, 2, 3, 4, 5, 6. Relax and release. So this was Vrikshasana. Okay, again a weight bearing posture. So it's going to encourage a lot of bone, good bone health on the hip area, knee area, ankle area. All right. Next, we are going to go one of the modified asana version. So what we are going to do in this position is it's like training of the back. You keep a distance of about 2.5 to 3 foot between the legs. Slowly lunge forward on one leg. And now keep your hands on the waist. Try to bend forward from the pelvis, keeping your back straight, and come back up slowly. Alright, so keeping your back straight, you're not curving your back. Okay, we are just trying to train our glutes. Okay, we are trying to use our muscles of the hip and the thigh. Let's do it again. So lunge forward, slowly lean forward. Stay there. 1, 2, 3, 4, 5, 6. Come back straight and relax. Okay, we do it same thing on the other leg. Lunge forward, bend forward, maintain 1, 2, 3, 4, 5, 6. Come back and relax. You will feel a lot of glute contraction when you are doing this asana. Okay, so if you are feeling the glute contraction, that means you are doing it right. Okay, so bend your knee again, bend forward, exhaling, breathe normal. 1, 2, 3, 4, 5, 6. Inhaling, come back and relax. And do it on the other side. lunge, bend, exhale, breathe in normal, 1, 2, 3, 4, 5, 6, inhaling, straighten up and exhaling, relax. Okay, one last time, lunge, inhale, exhaling, 1, 2, 3, stay there, 2, 3, 4, 5, 6, inhale, 1, 2, 3 and exhaling, relax. Change to the other leg. Breathe in and exhaling, 1, 2, 3, stay there, 2, 3, 4, 5, 6, inhale, 1, 2, 3 and exhaling, relax. Okay, so you see how we went symmetrically and sequentially, and when we are leaning forward, we are actually creating a lot of weight bearing on the leg. Okay, so I'm going to use this word weight bearing again and again because it's very important to build a better bone health. Alright, so this was the next asana. Now we are going to do Veerbhadrasana 2. Okay, so you keep a distance of about 3.5 feet. Turn your foot outside. Since we have already done the forward lunge, it's very important to do the side lunge as well, because you need to train your hip in various directions. Whatever direction you will train your hip in, the bone formation, okay, the stresses in the bone cells will align themselves accordingly. So it's important to train it in different directions, and that can be well achieved by all the yogasanas. So let's do this. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Turn the other side, exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Alright, we will do this once again, Veerbhadrasana 2. If you are suffering from any kind of knee injury, surgery, please avoid doing this asana. Any spinal surgery, any abdominal surgery, please avoid doing this asana. Okay, we are going to do this once again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Other side, exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Now what do you mean by muscle recruitment? Okay, so what happens, I'll give you an example with Veerbhadrasana 2 itself. What happens is, when we are doing Veerbhadrasana 2, many a times I have seen people sagging their body down, and it's not very active on the upper body, though the lower body is quite active, upper body is not. It's very important to keep yourself elongated when you are doing this particular asana, and which is why we are placing the hands at 90 degrees, so that it helps us keep ourselves erect. Okay, so it's not just the leg movement, but the upper body also needs to stay elongated, okay, when you are doing Veerbhadrasana. So please keep that in mind, okay, because again this is important in cases of osteoporosis, to keep your spine elongated. Okay, I'll explain you why. First, let's repeat this asana with a good muscle recruitment. Okay, so take your hands to 90. Inhale, exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Inhale at the place. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. And exhaling. 1, 2, 3. Alright, so this was about Veerbhadrasana 2. Now let's go on for Malasana. Okay, it's going to stimulate a lot of muscle work because we are going to get up from the ground. Here we are working more on the transition aspect of Malasana. So you keep about a 2–2.5 foot distance. Keep your feet rotated 45 degrees outside. Now slowly squat down completely, joining your hands in front of your chest. Try to push your legs with the help of your elbows and stay there. 1, 2, 3, 4, 5, 6. Now weight bear on your feet and push yourself up from the ground and relax. So this pushing action is what we are targeting in Malasana. Okay, if you are suffering from any knee osteoarthritis or knee surgeries, I would not recommend you to do this, but in any other case, it's very good to practice Malasana. Okay, so let's see it from the side. I'm going to explain you the mechanics of Malasana now. So let's go down fully. 1, 2, 3. With your back straight, try to maintain it straight. Stay there. 1, 2, 3, 4, 5, 6. Now while getting up, many a times I have seen people roll themselves forward, then get up. Okay, it's important to try and practice getting up as straight as possible. Okay, which means that you are recruiting the right muscles of your hips. Okay, if you are rolling yourself forward, it means that there are certain muscle weaknesses that needs to be worked on. Okay, that's absolutely fine. You can try to get up straight, but if it is not happening, try to practice that roll component. I'll show you how. So go down. If you are getting up like this, it's absolutely fine, but what you have to do is gradually try to recruit your glutes, try to recruit your calves, and then try to push yourself up. You will slowly learn how to become more and more erect with this. Okay, so this was Malasana. If you cannot do Malasana, it's also okay to do Utkatasana with a wall variation. Okay, so you keep your back against the wall, keep your feet forward, and slowly head is touched to the wall, shoulders, hips to the wall, go down, stay there. 1, 2, 3, 4, 5, 6, and slowly push yourself up. Okay, so this also can be done as an alternative in case if you're not able to squat down completely. Okay, we'll do it again. Inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. We will repeat this one last time. Inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Alright, so a good muscle work and a good weight bearing action. Now let's go on to some of the asanas which are in the sitting position. Okay, now we are going to start with weight bearing on our hands and our shoulders. Okay, we generally miss on this factor. We tend to weight bear a lot on our legs but forget our hands and our shoulders. So next we are going to sit down and we are going to go for Adho Mukha Svanasana, which is a downward dog pose. Just in case if you're suffering with frozen shoulder or any impingement or shoulder pain, it's better to avoid this asana. Okay. Now what we are going to do is we are going to go in quadruped. If you feel too much weight coming on your wrists, you can spread your fingers and place it down on the mat so that the weight is adequately distributed all throughout. Now what you have to do is slowly you need to push on your feet and straighten your
heels so that they touch the ground. Gradually push your upper body in towards the legs and stay there. 1, 2, 3, 4, 5, 6. Inhaling slowly. Get your knees down and
relax. Okay, so this was Adho Mukha Svanasana, some weight bearing on the hands and the shoulders. Okay, so we are going to repeat this once again. Now with breathing and counts. Inhale, exhale,
1, 2, 3. Stay there. Push from your hands to elongate and push your hips up. 2, 3, 4, 5, 6. Inhale. 1, 2, 3.
okay, so you can actually use the push of your hands to push your hips up and elongate your spine in Adho Mukha Svanasana. We will repeat this one last time. Inhale, exhale,
1, 2, 3. Now if you sag your hands, it's not going to create that kind of pressure and elongation. Push your hands and try to elongate your spine. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3.
so a good weight bearing posture of the shoulders. Next we are going to go for Falakasana. Okay, again a weight bearing posture. I am going to show you the alternative in case if you have wrist pain. Okay, but if you don't have, it's a very good idea to do this weight bearing asana. So you again go in quadruped position. Slowly push your knees straight, weight bear on your hands and your toes. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay. Now again, it's very important that your weight is equally distributed all through your arms. So all your muscles should be engaged. Wrist, elbows, shoulders and the spine. Okay, so the pressure should be equally distributed on both the sides. Alright, let's do it once again. Inhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Alright, one last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. If in case you are not able to bear weight on your wrist or you feel wrist pain, you can modify it by doing a forearm plank. So what you can do is you can go down lower and then do a plank in the same manner. 1, 2, 3, 4, 5, 6. Okay, so this is an alternative to the Falakasana that you can do. Next we are going to do the bird dog pose. Okay, so you go in quadruped position. Now this is even a simpler version. If in case you're not able to take the entire body weight on both your hands, what you can do is you can slowly practice just raising one hand at a time. Hold 1, 2, 3, 4, 5, 6, down, and the other hand 1, 2, 3, 4, 5, 6 and down. In case if you're confident of this, you can do an alternate hand and leg. So you can raise your hand up and leg. 1, 2, 3, 4, 5, 6. Relax. And on the other side, 1, 2, 3, 4, 5, 6 and relax. Okay, this is another way to challenge your weight bearing on your hands and your knees. Okay, so another way to do weight bearing. A very good posture again for the bone health. Okay, so let's repeat it one last time. Inhale. 1, 2, 3, 4, 5, 6. Exhale. Other side. Inhale. 1, 2, 3, 4, 5, 6. Exhale. Now many a times, some tips in this as well, many a times I have seen people being like this, okay. It's not the right way to sag your shoulders down and to push your thorax. It's going to create a lot of strain on your cervical area as well as the shoulders. So it's always better to push your spine straight up, maintain that position and then do the pose. Okay, so that's how you do it correctly. Now let's go on to some little bit slight backward bending pose. Okay, now why I'm not showing any forward bending much, because in osteoporosis there is a tendency of stooping forward because of the wedging of the spine. So a spine, the spinal bones can change their shape due to osteoporosis, due to weak bone quality, and the spine can actually go in forward bending. So it's not really recommended to do any forward bending postures when you have osteoporosis. However, otherwise, if you don't have any osteoporosis and you just want to encourage the bone health, then it's not a problem to do any kind of forward bending postures. Alright, so we'll do one backward bending pose wherein we come on our knees, keep your hands on your waist and slowly bend backwards. 1, 2, 3, 4, 5, 6, and come back up and relax. If you have osteoporosis, it's not even recommended to do extreme back bend. So something like chakrasana is not what you would like to do, okay, but a normal back bend is absolutely okay. So let's do it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. This kind of back bend is also very good for the neck muscles because we are keeping the neck against gravity. So a lot of recruitment happening of the neck muscles. Okay, so it's a really good pose to practice on a regular basis. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Alright, so this was a little bit of backward bending pose. Now what you can do is you can always do a side plank. There are different variations of side plank. It's an intense weight on the shoulders. So if you're already osteoporotic, you're not supposed to practice this pose. But to encourage bone health, yes, you can practice this pose. It's a very good pose wherein you keep your hand with the fingers facing forward. Keep your feet together and slowly, you can keep the other hand on the ground in front of you and slowly lift your waist up. Now you can keep your hand on your waist and hold that position. 1, 2, 3, 4, 5, 6 and slowly relax. It's not a very easy pose. So if you want to make it easy, you can forward fold your leg like this. Keep the other leg straight. Okay. Now you can slowly raise your waist up. This is going to make it a little easy. 1, 2, 3, 4, 5, 6. If you want even easier version, you can go on your forearm and then you can push your waist up. 1, 2, 3, 4, 5, 6. Relax. Okay, so this is what you can practice. It's again a very good weight bearing exercise on the arms and the shoulders. But to practice this, you should have a regular strengthening of the wrist, elbow and shoulders. Okay, let's do it on the other side. Same 3 variations I'm going to show you once again. Keep your legs together, slowly lift up your waist, keep your hand. 1, 2, 3, 4, 5, 6. Relax. One easier version, keep your leg forward, folded like this, and then lift up. 1, 2, 3, 4, 5, 6, and down. Even easier version, keep your hand on the ground, elbow folded, and push yourself up. 1, 2, 3, 4, 5, 6, and relax. It's working out a lot of your side muscles, okay? A good side stability as well as the shoulder muscle strengthening. A very good asana to practice on a regular basis. Okay, now let's go on for some lying down weight bearing poses. Okay, in osteoporosis, if you are suffering, then twisting to the extremes is not a good idea, but you can always do mild twists. That shouldn't be a problem. All right, so let's lie down on our back, turn on your side and lie down on your back. The first weight bearing pose is the Setu Bandhasana. So keep your feet bent, hands by the side, inhaling, weight bear on your feet and push yourself up. Stay there. 1, 2, 3, 4, 5, 6. Exhaling down. Inhale. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. Exhaling. 1, 2, 3. Once again, inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so this was Setu Bandhasana. Next, we are going to go for something on the abdomen. So let's turn on the abdomen. For the muscle work part, so if you have osteoporosis, going to the extreme back bend like a full bhujangasana may be a little bit risky, but you can always do a partial normal bhujangasana, okay, wherein you keep your heels together, forehead on the ground, hands by the side of your chest, use your back muscles and try to lift yourself up using your muscles. Stay there. 1, 2, 3, 4, 5, 6. Exhale. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Repeat this one more time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Relax. So this is Bhujangasana. Next, we are going to go for one last asana, that is Shalabhasana. So you keep your hands by the side. You keep your chin on the ground. And now slowly raise one leg at a time. Stay there. 1, 2, 3, 4, 5, 6. Relax. Inhale and exhaling. Raise. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Again, inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. So many a times I have seen when people do Shalabhasana, they tend to lift their chin as well from the ground. It's important to maintain your chin in contact with the ground when you are doing Shalabhasana. So like that. And inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6.
Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, 1, 2, 3. If you find this difficult, you can always place your hands under your thighs and do the same pose once again. Inhale, exhaling, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, 1, 2, 3. And relax in Makarasana. Just relax completely for a few seconds. Once you're completely relaxed, you can turn on your side and get up.
Alright, so these were some of the poses which are going to encourage your bone health. With this, I come to the task of the week. That is, I want you to practice Vrikshasana 1 minute daily on each side. Okay, so practice it daily. Make sure you're doing it on each side. Take wall support if required. If not, you can do without wall support. Click a picture of it and upload it on Instagram and tag TimesHealth Plus. Also, do follow TimesHealth Plus on their Instagram and YouTube channels, and also encourage others to do the same for more tips and recommendations related to yoga. Alright, so this was a sequence of yogasanas that are going to help in building your bone health. It's very important to make sure that if you have somebody osteoporotic at home, they are getting the right medical treatment for the same. Along with that, you also need to make sure that you have certain other things in place, like the environmental factors. If there is a person who is osteoporotic, you need to have adequate lighting in the house. You need to have non-slip mats at the place, okay, so that there is lesser chances of fall. You should declutter the area where they walk, okay. They should avoid walking on uneven surfaces, as jerks and bumps can actually lead to trivial traumas and bone injuries. So it's very important to take care of other factors. Okay. Besides this, educating your body on a regular basis, making sure that the mind-body connection is always there and it is always improving is a very good idea to keep yourself safe from falls, okay, prevent falls and build a good posture and prevent all the nuances of osteoporosis, okay. So it is very important to keep educating your body through these different asanas. Alright, I think that is it for today. Good morning, Prasanna Sanji. Okay, so that is it for today. I'll see you next time with some other different topic. Till then, make sure you stay present, move gently, and take care of yourself. Thank you and namaste.